A new study has found that opioids were behind a quarter of deaths among people in their 20s and 30s in 2021. Researchers from the University of Toronto say that the annual number of opioid related deaths doubled in Canada between 2019 and 2021 to 6,200. Of particular note was the five-fold rise in fatal overdoses among 30-year-olds in Manitoba, while nearly tripling in Saskatchewan and jumping 2.5 times in Alberta. The surge coincided with pandemic public health measures that reduced access to harm reduction programs. Tara Gomez, the senior author of the study, says that the sharp surge in fatal overdoses suggests that provinces must act quickly, and she is calling for more harm reduction services, including supervised consumption sites. Joining us now to delve into this further is Dr. Abhishek Raut, Medical Director at Appletree Medical Group. Dr. Raut, glad to have you back.
Great to be here, Julie.
A quarter of deaths for those in their 20s and 30s seems like an awful lot. Would you label the pandemic as the cause for the number being so high, or do you think it's merely a contributing factor?
Well, there's no doubt that the COVID-19 pandemic certainly had an exacerbating effect on the opioid crisis. I don't think it's the sole cause. The pandemic had led to a lot of social isolation, a lot of economic instability, and disruptions really in drug supplies and medication supplies, all of which could really contribute to the increased drug use and overdose risk. The opioid crisis was definitely a significant public health issue even before the pandemic. And we saw that it was driven by a lot of other factors, overprescription of opioids, for instance, and really lack of access to treatment for substance use disorders.
The study indicates that among opioid-related deaths, over 70% of them were among men. Are there reasons that addiction and opioid use could differ between men and women? And what puts men at the greatest risk compared to women?
I think that's something that we see from this study and many other studies as well. We see a much higher rate of opioid-related deaths among men, and usually we see a diversity of factors for that. We do know that men may be more likely to engage in riskier behaviors, including higher dose opioid use. They may also be less likely to seek help for substance use disorders due to a lot of societal norms and stigma. But we should keep in mind, of course, that the opioid addiction and crisis really affects people of all genders, and everyone who's struggling really deserves that access to help.
Could the increasing number of deaths be related to the opioids in question being toxic, or do you think that it's only a small part of the problem?
I think that toxicity of the opioids definitely plays a role in the increasing number of deaths. Many of the opioid-related deaths are due to illicitly manufactured fentanyl and its analogs, which is extremely potent, especially when mixed with other drugs. As an example, a lethal dose of heroin can be as small as 30 milligrams, but a lethal dose of fentanyl can be as small as 3 milligrams. But I think the problem is partially here, but also partially because of lack of access to treatment and a lot of the social determinants of health.
Provinces like Alberta currently use a strategy focused on recovery and abstinence-based treatment rather than harm reduction, mental health treatment, and housing. Do you agree with Alberta's strategy?
Well, I think recovery and abstinence-based treatment can be effective for certain individuals, but I don't think it's the right approach necessarily for everyone. So what we need to focus on is a more comprehensive approach to addressing the opioid crisis. And certainly recovery and abstinence-based treatment can play a role in that, among other approaches as well.
The lead author of the study is calling for more harm reduction services to counter the increased loss of life. Aside from supervised consumption sites, what other initiatives would help reduce the likelihood of opioid overdoses?
Right. So I think in addition to supervised consumption sites, likely the biggest gain we would find in reducing the number of deaths is a widespread distribution of medications that can help avoid death, such as naloxone, which is a medication that can reverse an opioid overdose. So having that available can certainly be very helpful for people. Other options that have been suggested, including having the ability for people to test their drugs to ensure that there's no presence of fentanyl or other dangerous substances as well.
Thank you very much for your time today, Dr. Raut.
Thanks so much for having me.